Hello guys, I'm Wali, official therapist. We have Joy here today. Joy, can you please introduce yourself?
Hello everyone, I'm Joy, a physiotherapist. I have been working with special needs children for 9 years now.
Today we will be addressing the issues of child development. As we know that during the first 2 years of baby life, the parents will probably spend more time for regular checkups. At each visit, the doctor will measure the baby's height, weight, head circumference, and then mark them on the growth chart. Other than that, the doctor will ask questions about how the baby is doing and whether the baby hit the milestone. Joy, can you tell us what the developmental milestone is?
Developmental milestone is a set of functional skill or age-specific tasks that most children can do at certain age range. Usually, the doctor will use this milestone to keep track on how the baby is developing. Okay, here are the example of the milestone for 1 month up to 6 months of age. 1 month old, gross motor, chins up in prone position, turn head in supine position. Fine motor, hand fisted near face. Social and emotional, discriminate mother voice, cry out of distress. Expressive language, throaty noise. 2 months old, gross motor, chest up in prone position, head bob when held in sitting position. Fine motor, retain rattle if placed in hands. Hold hands together. Social and emotional, reciprocal smiling. Respond to adult voice and smile. Expressive language, cool, social smile. 3 months old, gross motor, prop on forearm in prone position, roll to side. Fine motor, hand half fisted off the stem, inspected finger. Social and emotional, expression of disgust, sour taste, and loud sound. Visually follow person who is moving across the room. Expressive language, chuckle, vocalize when talked to. 4 months old, gross motor, sit with trunk support, no head leg when pulled to sit, prop on wrist, roll front to back. Fine motor, reach persistently, play with rattle. Social and emotional, smile spontaneously at pleasurable sign and sound, stop crying at parent voice. Expressive language, laugh out loud, vocalize when alone. 5 month old, gross motor, sit with pelvic support, roll back to front, puts arm out when falling, sit with arm supporting trunk. Fine motor, transfer object, hand mouth hand, reach, grabs dangling rings. Social and emotional, recognize caregiver visually, form attachment relationship to caregiver. Expressive language, say agoo, express anger with sound other than crying. 6 month old, gross motor, prop sitting with open hand, pivot in prone position, bear weight on one hand. Fine motor, transfer hand to hand, reach with one hand. Social and emotional, stranger anxiety, expressive language, listen, then vocalize when adults stop, smile and vocalize to mirror.
Joy, what if the child doesn't meet a developmental milestone? For example, a baby who is not rolling over by 4 months, is that considered as a delay?
Okay, minor differences in this milestone usually are not cause for concerns, but baby at that age, for example, they are not rolling over, cannot lift up their heads when they are lying or sitting, unable to push up when they are lying or their tummy, and unable to babbling are behind in more than one area of development can consider as a delay. Delayed development means that when the kids is continuously behind in gaining the skill that expected by a certain age. It can happen in just one area of development or in a few, while global developmental delays mean when the kids is delayed at least 2 area of development or more.
Okay, so you mentioned about there are few areas of development. May I know how many areas in total and what are those areas of development?
Kids are developed in 5 main areas of development. Number 1, cognitive skill. This is the ability to think, learn, and solve problems. Number 2, social and emotional skill. The ability to relate to other people. That include being able to express and control emotion. Speech and language skill. This is the ability to use and understand language. It includes understanding what's said and using words correctly in a way others can understand. Fine and gross motor skill. Fine motor. The ability to use small muscle group, especially in the hands. Example, grasping object, hold utensil, work with object, and writing or drawing. Gross motor, large muscle group in the body. Example, sit up, roll over, walking, jumping. Daily living activity. This is the ability to handle everyday tasks for children that include eating, dressing, toileting, and bathing themselves.
Some of the parents may think that babies should develop at their own pace. They shouldn't be challenged to do things that they are not yet ready for. Joy, can you share with us what are the warning signs of development that parents have to concern and take it seriously?
There are several red flags of a possible developmental delay in children. These include persistence of some primitive reflex more than 6 months of age. Primitive reflex are involuntary motor response origination in the brainstem that are present after the birth in early child development to facilitate survival. Example, rooting reflex. Appear at birth should be integrated 3 to 4 months. No response to environment or parents by 12 months. Not walking by 18 months. No clear spoken words by 18 months. No 2-word sentences by 2 years. Problem with social interaction at 3 years. Any delay or failure to reach normal milestone, for example, 2 months cannot rise up head when prone, 4 months unable to bring hand to midline, 6 months does not pass object from one hand to another. Falling outside the normal range are cause for concerns. If your baby is unable to perform tasks within the expected time frame, speak to your doctor.
You guys can also check out our official website to find out more on the developmental milestones and the warning signs of development from the age of 1 month up to 6 months and above. Yup, you know your child better than anyone. Do not be afraid to talk to your doctor as soon as you feel something is not right so that the doctor can carry out the developmental and medical diagnostic evaluations. Joy, how about the causes? What causes developmental delay?
Okay, the specific causes is unknown, but there are some risk factors can be considered. This may include before the child is born, during the birth process, or after the birth process. The risk factor of this developmental delay fall into 2 categories: genetic, chromosome abnormalities like Down syndrome, autism; environmental, exposure to certain toxic substances like prenatal alcohol exposure or lead poisoning; infection, premature birth, poor nutrition, lack of play and facilitation throughout the development process.
How about developmental disability? Is it same as developmental delay?
Developmental disability is that kids do not outgrow or catch up from, though they can make a progress. They are not the same as learning disability, but they can make learn more difficult. Conditions that cause developmental disability include Down syndrome, autism, and brain injury.
Joy, are there any treatments available for developmental delay?
Yes, early intervention and treatment are very crucial for children with developmental delay. Support from the multidisciplinary team can improve various areas of development. These therapies include physiotherapies, often helpful for children with delay in gross motor skill. Occupational therapies, these can address fine motor skill, sensory processing, and self-help issues. Speech and language therapies, typically used to address problem in area of understanding, produce language and speech sound. Early childhood special education provides stimulation for early developmental skill, include play skill. Behavioral therapy. This may be needed in some children for behavioral difficulty that affect social appropriate behavior.
So it means that each member of the team has important contributions to make in the care of the child, right? So what is the role of a physiotherapist in helping the kid with developmental delay?
The physiotherapist will first evaluate your child, conduct an appropriate detailed test to determine your child's specific strength and weakness, and then get to understand your child based on your observation on the development, and then we discuss further concern. In addition to evaluate your child and the environment in which the child moves, the physiotherapist will give detailed guidance on building motor skill one step at a time to reach the established goal. The therapist may guide and facilitate on the child movement or provide cue to help the child learn new way to move. For example, if the child is having hard time learn how to pull himself into standing position, the therapist will show or guide the child how to lean forward and push the feet off from the ground. For example, so when the child is in sitting position, cross-sitting position, the therapist will guide the child how to move step by step. Okay, from cross-sitting position, change into side-sitting position. So the child can use one hand to push himself into squatting position. And the hand can be in front of the child, so the child can support and lean slightly forward and lift up the buttocks from the floor. What if the child unable to stand independently by himself? The therapist will use various types of equipment to help the child to move and to stand safely. So we can use this parallel bar and the rollator. The therapist will teach the family what they can do to help the child practice skill during everyday activity. The most important influence on the child is family because they can provide an opportunity to achieve each new skill.
How about for parents or caregivers? What are their roles in handling the kid with developmental delay?
Children spend more time with parents and siblings than they do in the treatment sections. The parent's role should be changed from passive one into an active participating. Parents or caregiver can become sort of co-therapists, meaning that while therapists decided on the treatment plan and goal, the parents are expected to perform the treatment activity at home in cooperation with the rehab treatment. Parents can play a crucial role in transferring home exercise program into daily functioning of the child.
Juggling work, home life, children's schedule and more can feel impossible on some days. Even though with the busy life we lead, it is important to allow time for free play and playfulness. Children who feel loved and secure tend to play and explore their environment more. There doesn't need to be a set time on each day to focus on development. Every activity that you and your child carry out together is an opportunity for them to learn and grow. Joy, crawling is quite a hot topic among parents. Based on your experience, what if the child never crawled and started to walk one day?
Crawling is reciprocal locomotion on hands, knee while lifting up the trunk from the floor. Crawling becomes baby's primary means of locomotion to explore his environment and to obtain the toys. Studies indicate that crawling not only preparation for walking, but a various process assisting in development of many components such as body scheme, motor planning, visual perception, and eye-hand coordination. Thus, reduced input associated with limited crawling can affect certain areas of development.
So whether a baby who is learning to crawl for the first time, a baby who is being encouraged to crawl even though they can walk, or an older child is crawling just for fun, there are therapeutic benefits for them all. Jai, do you have anything to add on?
Developmental delay should be identified and treated as early as possible, as the child brain can easily change and also can respond to training that will help them learn the skills that are lacking. Cooperation from parents and therapists is needed to determine full success.
Here are a few key takeaways before we move. Developmental delay is common. It can evolve in either single domains or multiple domains of the child functionings. Your child's development is a journey. Monitoring and screening show you the way. Early detection and intervention is important to help the children develop and learn the essential skills. That's all from us. Thanks Joy for your sharing, and thank you so much for watching. Check out our social media and official website for more info on developmental milestones and developmental delay. See you guys in next episode.